Now we look into another important condition, that is Kaphaja Kasa. After Pitta Kasa, we'll come into Kaphaja Kasa. So what do you mean by Kaphaja Kasa? Now here we have to understand. If the Pitta Kasa is promptly treated in time, okay, the disease will go into subside. And if Pitta Kasa is not treated properly, then it may lead to Kaphaja Kasa. Okay, what we say, bronchitis. Okay, bronchitis like condition. Kaphaja Kasa may be there. That means now the disease is now slowly entering into the lung parenchymal area. Okay, slowly entering into the lung parenchymal area. And we know that as the disease pathology goes inside, the intensity of the cough will go into reduce. Cough is maximum in the upper respiratory tract, isn't it? And that means starting from the larynx up to the tracheobronchial junction. As the disease is going inside, when I say bronchitis, it involves the whole bronchus, isn't it? As the disease is going inside, the intensity of the cough will come down. That's the reason when the cough is less, you have to be careful. In Kaphaja Kasa, exactly what happens is, first time in Kaphaja Kasa, there is appearance of loss of appetite. Okay. Now this is very important. See, so far in Vata Kasa and Pitta Kasa may be there with loss of appetite if the fever is more predominant. Because of the fever, there may be anorexia. Okay, aruchi. Okay. In plain Pitta Kasa, the classics not mentioned any aruchi or loss of appetite like symptoms. Okay. But when you come to Kaphaja Kasa, now there is appearance of loss of appetite. So why I am telling is, loss of appetite is one of the constitutional symptom. Okay. Now in Vata Kasa and Pitta Kasa, there is no constitutional symptoms. Constitutional symptoms means loss of appetite, okay, loss of interest, then dullness, okay, irritability. So these are all the constitutional, loss of weight. These are all the constitutional symptoms. Especially in children, these constitutional symptoms are very important. Okay. Now for the first time in the Kasa sequence, in Kaphaja Kasa, we are getting the appearance of loss of appetite. Now we have to see whether Kasa is there with the aruchi or not. If the Kasa is there with the aruchi and intensity of the Kasa is less, okay, so that is exactly the Kaphaja Kasa. So what he says in Kaphaja Kasa is, there is aruchi, loss of appetite, then there is heaviness of the body. Okay, again cough ka symptom hai, heaviness of the body. And patient feel the madura taste in the mouth. Okay, madura taste in the mouth will be there. Then there is formation of the sweetish sputum. Okay, sputum hai, but sputum thoda halka sa aisi sweetish hai. Okay, then angamarda is there. Okay, again one more constitutional symptom, angamarda, body pain. Okay, then Kasa is causing less discomfort. That is very important, because that means severity of the cough is less. That means severity of the cough is less. But patient is feeling kapha purna deha, whole chest area is filled with the cough. It is heavy. So this feeling will be there. And there may be headache. Lot of sputum is formed. But it is not foul smelling. Again, one more thing. So it is, as it is not foul smelling, it is not inflammatory cause. It is not inflammatory. Although there is a lot of sputum, copious sputum is there, the cause is not inflammatory. Okay, so cause is something other than inflammatory. Cause is something other than the inflammatory, and maybe this is a disease pertaining to the lung parenchyma. Okay, not a disease pertaining to the upper respiratory tract. Okay, so now one thing is very clear: there is heaviness of the body, loss of appetite is there, then a lot of sputum is formed, and cough is less severe. So that suggests that we have to be careful. Cough is less severe. So this point towards some of the chronic conditions. Okay, these are some of the chronic conditions which leads to Kasa. Okay, even there is no fever. Fever is not a frequent symptom here, or fever is not mentioned. So now, one thing is clear, this is something related to chronic causes of the cough. We have got so many chronic causes of the cough. Okay, that we will see in later part. Okay, so this is a chronic condition. Okay, chronic condition, we know that discomfort is always less. Okay, discomfort is very less. Now, but it becomes chronic. Now, if the chronic, when a disease can be chronic, if the Kasa is there, Kaphaja Kasa is there. That Kaphaja Kasa is now becoming chronic, or Kaphaja Kasa itself is a chronic condition. When a Kasa can be chronic, Kasa can be chronic when the Nidanas are continued. Suppose you are taking the Nidanas continuously. Okay, in spite of the disease, you are taking the Nidanas. You are exposing to the dust, fumes, or whatever causative factors, you are continuously exposed. Okay. Number 2 is Kavaigunya is persisting. Kavaigunya means a problem in the Shotas, we know that, isn't it? So Kavaigunya may be a structural or it may be functional. For example, if I say some congenital abnormalities are present in the respiratory tract, actually it is a structural Kavaigunya. Okay, and if ciliated columnar epithelium cells are not clearing the throat normally, then it is a functional Kavaigunya. Okay, so some Kavaigunya is persisting. So commonly some of the structural problems. Okay, maybe you can say the congenital heart disorders. Okay, some of the disorders, congenital problems related to the respiratory tract, maybe DNS, maybe adenoids, or maybe tonsillar, enlarged tonsils, or maybe conal atresia, or some other problems, obstruction, mechanical obstruction, etc., related to the respiratory tract. So that means that Kavaigunya is persisting, and that may lead to the chronicity. Okay, next. Another is, as in child, the normalcy of the Kapha is not achieved. We say that childhood period is a Kapha dominant period. Although it's a Kapha dominant period, the Kapha is not completely stabilized there. Okay, that means immunity is not completely stabilized. It is on the way of stabilization. Okay, so that may itself, that means less immunological capacity of the child may also lead to the chronicity. Okay, Kavaigunya may lead to the chronicity. Okay, instability of the Kapha may lead to chronicity. If the Nidanas are continuously continued, that may lead to chronicity. And if there is Viruddha Ahara Sevana, and if the child is consuming the Viruddha Ahara Sevana, that may also lead to the chronicity. Okay, if there is exposure to Dushivisha, allergic substances, again, continuous exposure to the allergies. Okay, initially there will be Vata Kasa and later it may be get converted into Kaphaja Kasa because of chronicity. Okay, now we have got certain conditions like cystic fibrosis. Okay, some of the hereditary condition, cystic fibrosis. Cystic fibrosis where the bronchial secretions are blocked, and so that the secretions are not clear, and that leads to the problem. Okay, that we will discuss later. Cystic fibrosis, one of the conditions. Now there will be Kasa. Kasa is mild, and this is one of the chronic condition. So if such causative factors are there, then a Kasa can be chronic. When it is chronic, usually it is associated with so many constitutional symptoms. Any condition, tuberculosis is a chronic disorder, we have got so many constitutional symptoms. Okay, and similarly, in a GAT chronic problems, we will have a lot of constitutional symptoms like a loss of weight, loss of appetite, loss of interest, etc. So, presence of the chronic constitutional symptoms, it suggests towards the chronicity of the disease. Okay. So now Kaphaja Kasa can be chronic if all these points which is explained here is continued or existing. Okay, now if this is the case, what is your treatment? What is the treatment? Number 1 is Nidana Parivarjana, that is must and should. Okay, that's the basic part. Now, apart from that, a lot of cough is formed in case of Kaphaja Kasa. A lot of cough is, copious sputum is there. Okay, Kapha Purna Deha is there. So, mucolytic has to be taken into consideration. Here we have to go for mucolytic drug. That means a drug which can effectively break up the sputum into small parts and expel it out. Okay, so condensed kapha which is condensed, so that will be broken into small pieces and it will be expelled out, and this will be done by the mucolytic. Okay, now one of the common group of drugs which can act as mucolytics in Ayurveda is Solanaceae group of drugs. All the Solanaceae group of drugs, Brihati, Kantakari, etc. So they actually, as a chemical constituent, they contain bromohexane. Okay, in Vasa and Kantakari, it is the percentage is more. In some of the other drugs of Solanaceae family, percentage is less, but it contains bromohexane, and bromohexane is one of the mucolytic drugs according to contemporary medical science. Okay, now so first go for mucolytic, then expectorant. You can use the expectorant to remove the drugs. So some of the Ushna and Tikshna drugs can be used, or Shoto Shodaka drugs can be used to which effectively remove the the split down mucosal plugs. Okay. Now, very important in this case of Kaphaja Kasa is use the Lavana. Lavana and Lavana Tailas, they are very important. Lavana Taila Abhyanga is also very important because Lavana is Kapha Abhishandakara. Okay, Kapha Abhishandakara. So, in order to liquefy the Kapha, we have to go for the Lavana Chikitsa. Okay, so even Lavana Jala Yukta Sadhya Vamana can be also performed at times. Okay, at least externally you can go for application of Lavana Tailas, Brahasaindavadi Taila, etc. Then you can even use the Kshara. Because Kshara is also causing Kapha Vilayana. So these are some of the common drugs. For the Kshara, even as we use Tankana, along with Sitopaladi, you mix some of the Tankana that acts as Kshara actually. Okay, so it helps for the Kapha Vilayana. Okay, now other treatment which is explained in case of Kaphaja Kasa is a Snehana. Okay, you can do the Snehana over the chest area. And Snehana should be followed by the Svedana. Okay, now Svedana can be done by means of Patasveda, or Svedana can be done by means of Patra Sedva. Okay, or even in the small kids, even you can go for Hasta Sveda also. Okay, different Patras, Nagavalli Patras is usually used. Okay, and then the Nagavalli Patra Lepas are used, and some other Lepas can be also used for this Svedana purpose. Anyway, Svedana can be done by Patra Sveda or Patasveda, and this will be followed by Sadhya Vamana. Okay, by using some of the Vamanopaka drugs, or individually, or simply you give some of the Vamanopaka drug like Vacha or Yashtimadu. Okay, so now this is another important type of treatment in case of Kaphaja Kasa. What you have to do? Snehana followed by Svedana, and then go for Sadhya Vamana. Of course, Sadhya Vamana can be done without Snehana and Svedana, but if you go for Snehana and Svedana, then the patient discomfort is less and effect is more. Okay, then Vamanopaka drugs can be also given. Now, Lavana Taila Abhyanga, I mentioned many times, Lavana Taila Abhyanga over the chest, anterior portion and posterior portion, and also for the neck area, go for thorough Abhyanga, and this will be followed by some mild Svedana. Okay, the Abhyanga should be done by Lavana Taila because Lavana is Kapha Abhishandakara. Okay, now Kapha means there will be Aruchi is a symptom, and there is also loss of appetite. So now you have to go for Deepana Chikitsa. Okay, so Deepana Pachana Chikitsa should be also given here. Now, when a Kapha is formed, a sputum is formed, rather, when the sputum is formed, now sputum initially there is dry cough, and then there will be Kaphaja Kasa, then there will be Ardra Kasa, and then there will be Shushka Kasa. So like these three stages are there. Shushka Kasa can be taken as a dry cough. Okay, then Ardra Kasa is a copious sputum. Okay, copious sputum is there. See, wet sputum, that means wet cough is there. In the previous classes also I told that when the cough is present in the upper respiratory tract, the dry cough is more, irritant cough is more. But when the disease goes into the lower respiratory tract and lung parenchyma, the cough become wet cough. Okay, so this Kaphaja condition, therefore I am telling, it is not a disease of the upper respiratory tract. It is a disease of the lower respiratory tract involving some portions of lung parenchyma or greater portions of the lung parenchyma in the advanced stage of the disease. Now, what is the fate of Kaphaja Kasa? Suppose Kaphaja Kasa is there. Okay. One thing is Kaphaja Kasa can be resolved. If you observe in all the Kasas, usually when the Kasa start for us, when we get the cough, usually start as a dry cough. Okay. After 1 or 2 days, and there will be some difficulty and some burning sensation, etc. will be there. And later onwards, there is formation of the sputum, and afterwards the cough is resolved. Okay, so this is one fate, how this goes in normal condition. Now, if the Nidanas are continued, okay, then it leads to chronicity. Okay, again the same thing. The why it leads to chronicity. Once it happens to chronicity, chronicity can occur in condition like cystic fibrosis, asbestosis, silicosis, or some foreign body is lodged there. So these conditions which may lead to chronicity. Okay. So by this time the pathology reaches the terminal portion of the lower respiratory tract. Bronchus, trachea, everything is involved, and now it goes to the lower part of the bronchus, tertial bronchus. And if this Kaphaja Kasa, when it reaches the tertial bronchus or respiratory bronchial area, or up to the alveolar area, or we can say interstitial lung area, Okay, now it will become very chronic, and now it manifests many other symptoms. That means the same Kaphaja Kasa, when persisting for a longer time, when the disease become chronic and still the nidanas are continued and not treated properly, the disease enter into the lung parenchyma, or it becomes an interstitial lung disease. And now same Kaphaja Kasa leads to next condition, that is called as a Kshatraja Kasa. Kshatraja Kasa. Okay, Kshatraja Kasa and Kshayaja Kasa. These two are the conditions which are present in the lung parenchyma. Okay. Vata, Pitta and Kaphaja Kasa, these are actually present in the upper respiratory tract. Kaphaja Kasa, if improperly treated, it may also lead to the lung parenchyma involvement. Okay, but Kshatraja and Kshayaja, definitely they are not the disease of upper respiratory tract. They are the disease of lung parenchyma. It may be interstitial lung disease or parenchymal lung disease, okay, alveolar disease. Okay, so this is about the Kaphaja Kasa and its treatment. Now, in the Kaphaja Kasa, there is one variability. What is that? Again, one more variant of Kaphaja Kasa. Sometimes Kaphaja Kasa may be associated with Vataja symptoms. Kaphaja Kasa may be associated with the Vataja symptoms. So, Kapha, we know that it is an immunity factor. You know, Kapha means it is immunity factor. Now, there are some conditions of immune exaggeration, hypersensitivity reaction or reaction to anything. So it is basically immunological. So whenever there is some hypersensitivity reaction like sneezing, over sneezing, etc., definitely there is some fluctuation in the kapha also, because it's, after all, it is a immunological reaction. Okay, but sometimes there is also vata aggravated. Okay, in case of hypersensitivity reaction, when kapha is destabilized by or fluctuated by vata, okay, so that leads to hypersensitivity reaction. Kapha is nothing but immunological, and it is now triggered by the vata, leading to hyper condition. Okay, so this may lead to the symptoms like wheezing or sometimes dryness, nasal blockage, stuffy nose, sneezing, etc. Okay, so this is such conditions. So one variability of Kaphaja Kasa is Vata Kaphaja association. Okay, allergic bronchitis, trophical eosinophilia like condition can be considered under this. There will be a hyperactivity of the immune system. Sometimes there may be also, that means as the Vata is involved here to more extent, sometimes there may be also some bronchospasm. Okay, so along with that, there will be also some bronchospasm. When the bronchospasm is there, patient will have breathing difficulty. Okay, now Shwasa is there. Bronchospasm leads to Shwasa. Dyspnea will be there. Okay, so sometimes you can find such conditions where Vata Kaphaja association. Okay, Kapha is also more, along that Vata is also now working, and usually that leads to such type of condition with the bronchospasm. One more variability is Kapha Pittaja Kasa. When Vata is associated, it leads to hypersensitivity reaction. When Pitta is associated, now it leads to some of the rashes in the body. You can see many times there will be cough, cold, etc. is there. Child is also developing skin rashes. Now it clearly suggests that there is an involvement of the Pitta. Okay, because of Pitta only this Raga, Mandala, etc. is coming. There is involvement of the Pitta. So along with the Kasa or mild wheezing, in the whole over the body, the child is also having reddish patches and arctic area or ring-like patches, etc. This clearly suggests that this particular Kaphaja Kasa is associated with the Pitta. Now we have to go for a Pitta treatment. Usually one Kamaduga Rasa will going to give a very good result, or even Avipatika Chuda. Okay. So now what is the treatment of the first condition? Vata Kaphaja Kasa. Vata Kaphaja Kasa. So if you see the treatment of Vata Kaphaja Kasa, where hypersensitivity like reactions, overreaction, okay, hypersensitivity reactions are happening. One is you have to go for Nidana Parivarjana. Then again, in that condition also, Pitta is involved, therefore, Kapha is involved leading to Aruchi, etc. Also go for Amapachana by using Shunti and Pipali. Then first stabilize the Kapha, because Kapha is get fluctuated. So immunomodulatory drug, some of the immunomodulatory drugs should be given. Then some of the mast cell inhibitors which are available, or mast cell stabilizers which are available in Ayurveda, like Shirisha or maybe Haridra or Laghusuta Shekhar Rasa, can be given. Then Tikta Gritapana can be given. Then Yashtimadu. Yashtimadu helps in recurrence. Okay, Yashtimadu also can be given. It prevents the recurrence. Then inhalation therapy. Now you can go for some of the inhalation therapy also. Okay, Snehika Dhumapana you can give. When Vata is involved, Snehika Dhumapana, or any inhalation of the steam with any aroma drugs. Okay, so that can be given. Even Dhupana can be given. Okay, now if it is Pitta Kaphaja involvement, then Pitta Hara treatment should be given. As I told, maybe Manjishta, Avipatikara or Tikta Gritapana can be considered. So these are the two variables of Kaphaja Kasa. Plain Kaphaja Kasa can exist, but very rare. Kaphaja Kasa either will be associated with the Vata or Kaphaja Kasa associated with the Pitta. In both the conditions, we have to identify the clinical condition. In Kaphaja Kasa associated with the Vata, the patient will have almost all acute attack. Although Kapha is known for chronicity or less discomfort, the patient is having more discomfort because of Vata involvement. Whereas in Pitta involvement, patient will have skin involvement and other mandala, raga, etc. Redness of the body, etc. So in both the conditions, the treatment will going to differ. So this is about a Kaphaja Kasa. The next part we will see the Shataja Kasa, as I told, which is a lung parenchymal disease.